we'll read them out. 083 3500 530. Now, in studio with us, as per usual on a Wednesday, is Gabriel McSherry, medical herbalist and nutritionist. Very good morning to you, Gabriel.
Good morning, Niall.
And thanks for joining us. There was a woman earlier wondering what you could do about a wasp's nest in the shed. I don't suppose your expertise extend that far, but anyway.
It's not actually, no.
No, that's okay. Didn't
but
expect
I know
it would be.
wasps are different than honeybees. So, there's a number of ways you can move honeybee hives and stuff, but I think the wasps are different.
Right, okay.
But I'm not too sure.
All right, well, that's more than I thought I'd get out of you in that. But anyway, okay. All right, a number of questions left over from last week, and keep your questions coming for Gabriel. 0818 365 500, and as I said, the text number 083 3500 530. And just picking up from last week where we left off, bloodshot eyes, a person has a problem with, Gabriel. They don't drink and usually get a good night's sleep, yet they have bloodshot eyes. What possibly could be the problem, do you think?
So with bloodshot eyes, there can be a number of things causing it, and I suppose with the description there, they've ruled out fatigue and eye strain. And I suppose some people get kind of boozer's eyes, so he's kind of ruled that out as well. But other things like a trauma, a whiplash from car or something stuck in it. So we'd probably rule them out too. He probably has it a long time. Could be due to chemical exposure from smoke or an allergy. So if he just gets it maybe in the summertime, possibly an allergy to something in the flora and fauna, maybe a hay fever type thing. But in general, if it's there all the time throughout the seasons, it could possibly be some sort of inflammatory disorder. There's certain autoimmune conditions, and they can present like that in dry eye or irritated eyes. And if it's something like that, things like iritis, uveitis, conjunctivitis, sore gun syndrome and stuff like that, it's a bit complex, the treatment. But what they can try is marigold tea, so the marigold flower or calendula, make a tea of it, let it go cool, and wash the eyes with that, or just wash it with saline, so salty water, and just see does that improve things. Other than that, I'd have to probe more for allergies and stuff like that. One other thing to mention, I guess, is that if the person's on blood thinners, so aspirin or warfarin, medications like that could also cause it.
All right, okay, but they should get it checked out anyway. It's something they should look after. Okay, marigold tea you would recommend for that. Worth giving a try. Now, condition which many people suffer from this at this time of year, hay fever. My 5-year-old child has bad hay fever. Don't want to give him medication all of the time. Are there any alternatives?
Right, it's probably bad if she was giving him medication all the time and so on. Yeah, with any hay fever is an inflammatory or an allergic reaction, with inflammation generally around the nasal passages and around the eyes and so on. But with all allergies, I treat for food allergies. So I assess them and treat them for food allergies, and that'll make it a hell of a lot better. But in general, specific for hay fever, on a herbal medicine side of it, we use eyebright or echinacea, can work very well. Or also, what I use in the clinic is a very well-researched blend of herbs. It's been used in Germany for 70 years, this one. A lot of clinical trials on it as well to show its efficacy. But it's a mix of 5 herbs. They're gentian, primrose, sorrel, elderflower, and vervain. So I make them up at the clinic, and they're very effective for the symptoms.
You find it works, yeah?
Yeah. Yeah, and there's 2 quite large randomised controlled trials where they use it on people with hay fever and allergic rhinitis, and it has shown significant effectiveness.
Okay, how's hay fever been general this year, Gabriel? Have you found it? Pollen levels been high? Or?
Yeah, well, funny enough now, Sky News I just saw it recently, they do a pollen thing, and it's quite low around the west of Ireland, and it seems to be higher in England and the east of Ireland. So going by that, maybe it's not too bad. But I see the regular amount, I suppose, of people who come in this time of year for pollen allergies.
All right, okay. Warts, getting rid of warts. Can Gabriel remind listeners once again what you said about getting rid of warts?
Yeah, we discussed warts a few times, and probably what this is to do with. Last week we talked about plantar warts, which are warts you get on the ball of your foot or on the palm of your foot, which are, well, all warts are virus. You know, they're a papilloma virus. So generally I give internal antiviral herbs, but a good tip I gave out last week for plantar warts, or warts on the feet, and that's probably what people want reminded of. It's and it's very effective. And here it is. You get I use first of all, you'd get a bit of sandpaper or a kind of a beach stone, and you wash the feet, and then you kind of sand down the wart, not too heavy, and just to clear off all the dead skin. And then I use a fluid extract, so an alcohol aqueous extract of a herb called Thuja, Thuja, and that's antiviral. And then you get duct tape. So that's the key, is the duct tape.
This caused a lot of amusement last week when you mentioned
it. It did, yeah, because people think it's very simple, and because the person who rang in actually had it frozen by a chiropodist for maybe 10 times, and it still came back, and they were thinking, well, what can duct tape do? But trust me, it's very effective. And but put on an antiviral herb on top of it, and then put on the duct tape, and repeat that you might have to repeat it for a number of months, but see where you go. I've used it clinically with brilliant results, and it's something simple you can try once you get the herbs, you know.
Okay, so you pare down the dead skin with a bit of a stone or something.
A bit
like
of a stone, or you know, they sell them sometimes in chemists, I think, for corns and that in your feet. But also a little bit of mild sandpaper, and just it's really to get the kind of surface stuff off, and then apply the herbs. So you're trying to get it down into the base of the virus.
Duct tape on top of that.
Then duct tape on top, and cover the whole area, and leave it on for a day or two until you wash and that, and then repeat. And repeat that then for a couple of months.
All right, okay.
And
it's
see how it goes.
Yeah, common problem, as we say as well. My leg and foot keeps swelling. It's not painful, and when I rested, the swelling starts to go down. What could cause this? I feel healthy, don't feel sick or anything.
This is an interesting one. Because there's no pain, it'd probably rule out a fracture. Now, some people can have a fracture there for long term, you know, and but they generally get pain. I'm thinking it's probably water retention or edema. And it could be a number of causes. It could be heart and vascular system. It could be hormonal. And the key is to the best thing to do for me is to see this person, but is to treat the underlying cause of that. Check, get your blood pressure checked, see is the heart all right, and rule that out. Because what's common in people with reduced heart or vascular function is that they could get water retention in their legs or their ankles, in their feet, and then they may report when they're at rest it goes away, but they might sit down and maybe elevate their feet and it'll go away. And what's happening is the fluids of the body are pooling in the extremities when one's up and active and standing up, and really there you treat the vascular system, you know, diuretic herbs or blood pressure herbs and so on.
Okay, wax in ears, Gabriel. I have to get the wax cleaned out of my ears at least twice a year, maybe 3 times in some cases. Any ideas how to get rid of it?
Yeah, this is a funny one because it's, generally a little wax is normal. But if it collects and it thickens, it needs to be removed by a syringe. And we don't know what causes it or anything. It's just when some people, they tend to produce quite a lot of wax, and it thickens and it collects up. So it's something that they really just need to keep going and getting it syringed. But a few suggestions to soften up the wax in preparation for the syringe is to instill 3 or 4 drops of garlic oil into the ear, both ears. And again, garlic oil is really good for ear infections in children as well, just 1 or 2 drops in. Now, I make it myself at the clinic, but you can make it at home by using an olive or sunflower oil or something, and you get good quality garlic cloves and bruise them, bash them up, and soak it in the oil immerse it in the oil for a number of weeks, giving it a shake every day, and then you strain off the oil from it, and then you have a good quality garlic oil.
And perfectly safe to put in the ear as well.
Very safe,
even if it's homemade.
Yeah, definitely. And it's antimicrobial, antiviral, antifungal, and only put in 1 drop for infections. But in this case, to loosen up earwax, thickened earwax, you can put in 3 or 4 drops. But again, it's just in preparation for the syringe, and I think the syringe is necessary. Castor oil and mullein oil is also a thing that you can put instead of the garlic oil.
Okay, I'm waiting on a knee replacement operation. I have a lot of pain. Anything herbal I can take to ease the pain?
Yeah, something I give to people with arthritis or joints that are worn down over the years and stuff and cause a lot of pain is a topical balm. It's arnica. I make it up with 10 oils, right? They're herbal oils. Arnica is one of them. And arnica, it can do a bit of healing in cartilage, tendon, ligament, and so on. If they're waiting a knee replacement up, the knee is probably in bad shape. It's probably bone on bone, very painful. So there's other oils in there that are just good for the pain. The rubefacient, so they draw circulation to the area, which can have a healing effect. And it's really good to put on at night time just to reduce that pain in bed, because sometimes it can affect sleep. Comfrey oil is something else I try, and that they're all topically. And internally I take adaptogen tonics, which are herbs that are just really good to build up the body. And they're withania, the ginsengs, rhodiola. Other advice I'd have for that person is you can get the body ready for surgery by building up the body, getting the nutrition right, exercising. Even though the knee is banjaxed, you can still maybe do some exercise in a pool. And it's important to kind of get the body in good shape prior to surgery, and then therefore this is well clinically proven in the literature that recovery time is much shorter, and repair time is much better if one is in general health. And that's why athletes can have really severe joint or knee injuries, and they can be back on the football pitch in 8 weeks or whatever. It's just their general level of fitness is good. So that's something to recommend there.
All right, okay, I think we're going to take a break. We have lots of questions coming in. We'll take a break and deal with as many as we can in a few moments.
Ocean FM.
Time on Northwest Today, thanks to CMD Training Institute. Training today to meet the challenges of tomorrow. CMD Training Institute.
Ocean FM.
Northwest Today, with thanks to Feeney's Garden Centre, Glencar, Sligo. Beautiful location, beautiful plants, great deals available. Open late Thursday and Fridays until 8 p.m. The largest garden centre in the Northwest. Feeney's Garden Centre, Glencar. 071 914 8066.
This is Ocean FM.
Hi, Marion Fitzgerald here, inviting you all to join me every Tuesday evening between 7 and 9 p.m. for Ocean Country. Brought to you in association with the Holyrood Hotel, Blue River Spa and Leisure Club Bundoran, right here on Ocean FM.
Ocean FM.
When a stroke strikes, the damage spreads like a fire in the brain. But unlike fire, you can't see the damage. To spot the signs of a stroke, you have to act fast. F. Face. Has their face fallen on one side? Can they smile? A. Arms. Can they keep both arms raised? S. Speech. Is their speech slurred? T. Time. It's time to call 999 if you see any of these signs. The faster you act, the more of the person you save. When stroke strikes, act fast. Brought to you by the Irish Heart Foundation. For more, log on to stroke.ie.
Relaxing on the beach in Crete, the south of France, or somewhere in Australia. Wherever you are, it's always a good time to call home. See the world as one this summer. With O2 Travel, you can call home for a flat rate of 30 cents per minute from 79 countries worldwide with one connection fee. Just free text TRAVEL to 50202 before you go. O2, together is better. Minimum connection fee of 79 cents applies and is country dependent. For O2 Travel terms, see o2.ie.
Want to cook something delicious this weekend? Well, ask Nevin.
Hi, I'm Nevin Maguire. Great food